The New York Times reports from the Baxter Regional Medical Center, the largest hospital in north central Arkansas, where fewer than 1/3 of residents are vaccinated, and even fewer people are protected in surrounding counties that the hospital serves. It found, quote, in the first half of June, the hospital averaged only 1 or 2 COVID-19 patients a day. On Thursday, 22 of the unit's 32 beds were filled with coronavirus patients. 5 more were in intensive care. In a single week, the number of COVID patients had jumped by 1/3. Hospitalizations have quadrupled since mid-May. More than 1/3 of patients are in intensive care. The retired National Guard colonel who runs the state's vaccination effort said, quote, we've tried just about everything we can think of. For about 1 in 3 residents, he said, I don't think there's a thing in the world we could do to get them vaccinated. He added that door knocking would probably do more harm than good, given residents' suspicions of federal intentions. Over to Missouri. Missouri has now seen more than 1,000 new cases in a day for the 6th straight day. Joining us now, staff writer at The Atlantic, Ed Yong, who recently won a Pulitzer Prize for his reporting on COVID-19. Ed's new reporting is on what the Delta variant is doing to Missouri. Reading from it, Ed, from your piece, quote, many experts have argued that even with Delta, the United States is unlikely to revisit the horrors of last winter. Even now, the country's hospitalizations are 1/7 as high as they were in mid-January. But national optimism glosses over local reality. For many communities, this year will be worse than last. Springfield's healthcare workers and public health specialists are experiencing the same ordeals they thought they had left behind. But it feels worse this time because we've seen it before. Amelia Montgomery, a nurse at Cox Health, told me walking back into the COVID ICU was demoralizing. And I can't even imagine, Ed, for these frontline workers who put their lives on the lines, and many died, but those who made it through this, to be going back to this because people are refusing to get vaccinated. What did you find about Missouri?
It's really crushing their morale. These healthcare workers who I'd spoken to had just about got past the winter surge. They'd already seen the horrors of COVID, and they thought they'd left those horrors behind them. And they'd spent the spring, while the rest of us had an easier time of it, doing catch-up work and still working incredibly hard. And now they're getting pummeled by this surge, which has really taken them by surprise. They're seeing the same problems again. They're exhausted again. They're overwhelmed again. But they're overwhelmed in a situation when extraordinarily effective vaccines, plural, are available to people. And at a time when so much of the country seems to have left the pandemic behind, that is really crushing morale, and it's making it much harder to do the daily life-saving work that we all depend on them to do.
And what are they hearing? What is your reporting bearing out in terms of why these people are not getting vaccinated?
There's a lot of distrust. Obviously, the issue has become so heavily politicized that a lot of people have just completely made up their minds about the pandemic, about the vaccines. Issues range all across the board. People think that some people think that the pandemic isn't really a problem at all, that COVID is not a problem, that it only affects younger people. And sadly, a lot of the ICUs in the hospitals where I've spoken to staff are filling with much younger people in their 30s and 40s. And those people are much sicker than they were this time last year.
So I'm hearing that's the reporting is reflecting what I've been reading across the country, that when there is a rise in COVID patients in hospitals, they are younger and they are much sicker. But Ed, you talked about this being so politicized, and that's leading to some to not get the vaccine. What's politicized about science? I mean, science is facts. This vaccine has been around now for more than a year. People have seen the death toll. It is massive, and science is proving by actual results being seen across America that the vaccine works. I don't understand. What do you mean by politicized? What is happening in the minds of the unvaccinated that the concept of science is politicized in their minds?
Yeah, so I agree with you that the vaccines have proven their effectiveness, not only in the initial clinical trials, but also in practice. They work incredibly well, not only against the original virus, but against the Delta variant as well. I do think that people make decisions not only based on the evidence around them, but also on what they're hearing from their own communities and the people around them. And sadly, I think that issues about the vaccines and the pandemic have been completely embroiled in these political identities that, people are looking around their communities and how they're making decisions, and that's swaying what they're doing in response to the vaccines. And, unless we can sort of break through that, unless we can establish greater trust with people who are distrusting the government, the medical system, science as a whole, we are going to not make progress. And, I think people who I've spoken to in Southwest Missouri in the public health departments, they're trying very hard. They're making slow progress in establishing that trust with resistant communities, but trust is very slow to build, and Delta moves very, very quickly.
Ed Elise Shorten here. You have done just such a great public tribute with all of your fantastic reporting over the past year and have really just dove into this at such a granular level. If you had a recommendation to policymakers, what could the government and government officials be doing to better communicate? What could the general public, or I guess the media writ large, be doing to actually have an impact in this war of ideas when it comes to convincing unvaccinated people to go and get jabbed?
So what I've tried to do is to reflect the stories of the people on the ground who are trying to deal with this current surge, to show people what it's actually like to be a healthcare worker right now. I feel like those personal experiences are going to be more impactful than just showing stats of how quickly the Delta variant is rising. I've had emails from readers who've used those pieces to talk to their relatives who had no idea how bad things were in hospitals. I think if for most of us going out right now, birds are chirping in the streets, people are having fun in the summer. You wouldn't have any idea of what is going on in the emergency rooms in some of these places that are heavily unvaccinated. I've also talked about trust. Folks at the Southwest Missouri, the health departments in Southwest Missouri are trying really hard to get trusted voices to talk to their neighbors, whether it's firefighters or pastors or even people's neighbors, just going around door to door talking to folks about the vaccine in members of their own community and their own terms. I think that approach of doing community-led outreach on a very, very personal basis is going to be much more effective than sort of hectoring people from like a national platform.
Absolutely. So, Ed, my question to you is the unvaccinated who are suffering from COVID are also obviously getting a lot of disinformation, relying on some sort of disinformation. So who or where are they getting this information that they are so vehemently sticking to?
Unfortunately, a lot of different sources. Parts of the news, social media, from each other. I think, we're a social species and we look at what our neighbors, our friends, our families are doing. And, sadly, we have a large number of systems that allow misinformation to spread very easily across these networks. This problem, I think, has become worse over the last year and a half. A lot of people who are trying to get vaccination rates up say that people's beliefs are more entrenched than they were a year and a half ago. And often it takes experience with the virus in your local community. It takes seeing your own loved ones dying around you to change people's minds. And often, unfortunately, that's too late.
All right. Ed Yong, thank you so much. We'll be reading your new reporting for The Atlantic. We really appreciate it. Thank you for coming on the show this morning.